it's Kira. Welcome to our first episode of Q&A with Super Kids Speech. In our intro video, I let you know that I wanted to take some questions from parents to help guide parents that might have young children 0 to 5 that have some questions about their child's development, whether they're meeting milestones, when they should worry, what options they have in terms of therapeutic intervention at different ages. So here goes. Our first question is from a mom of a 20-month-old child. As a disclaimer, I just wanted to let you know my private practice is in New Jersey. And so anything that I talk about that's statewide or state funded is all about the state of New Jersey because each state has their own rules, regulations, and programs. So if you're from a different state, please check your own state regulations. Okay, the question is, I have a 20-month-old that isn't talking much yet. When I brought this up to my pediatrician, he referred us to early intervention services. What is that? Do you provide that? And what's the process for getting my child speech therapy at this young age? Okay, so this is a great question because I do get some parents calling me asking about early intervention services. So I'll tell you the difference. I have a private speech therapy practice located in New Jersey. I'm not affiliated with any state-funded program. Early intervention is, however, a state-funded program that's run per county, and there are individual agencies that have contracts with the state to provide these services to you. And so that's the difference. Some people go with early intervention or they go with private practice, or maybe they do a combination of both. So just to give you some information about EI, which we'll call Early Intervention EI for short, it is a New Jersey state-funded program that services children ages 0 to 3 and provides therapeutic intervention for children that might have developmental delays. It is a great program, and I enjoy telling parents about it because it is paid for on a sliding scale, so it's income-based, and sometimes these state-funded programs tend to be at a lower cost than private pay options. So if you have the option because your child is within that age range, then why not check it out? Okay, so if you have been referred to EI, and you don't need a referral, usually parents get guided to EI by their pediatrician, but you don't formally need a referral. You can call your county number if you just Google, early intervention Essex County, and you should get a number. You call them and you will be assigned a service coordinator, which is essentially your case manager. They'll do all your intake paperwork and decide whether they're going to move forward with an evaluation. They usually come to your home or go to your child's daycare. For the initial meeting, they tend to go to you. Now, disclaimer, it is COVID time, so things are being run a little bit differently. Things are being done virtually. Things are being done over the phone. I'm just going to tell you overall what the process usually is. I'm sure it looks a little different, but this tends to be kind of like the process. So your service coordinator will do your intake. They'll determine when the evaluation will take place. They'll go, like I said, to your home or child care facility, and then they will determine after that if your child is eligible for services. In order to be eligible, your child has to have a 25% delay in 2 developmental areas or a 33% delay in 1 developmental areas. And some of the developmental areas are communication, self-help and adaptive, sensory fine motor, gross motor, all of the areas are encompassed. If they meet the criteria, then you will be assigned a therapist, whether it be a developmental therapist, which is essentially a teacher, a speech therapist, an occupational therapist, or physical therapist. Those are all can be under the early intervention umbrella. And then the services are provided in your home or at your daycare facility. And you have your service coordinator will help you kind of get set up with billing and all of that stuff. They take all of your information. Now, the process can take a long time. The state is legally obligated to provide you with a timeline. So It's different for preschool and elementary, but for early intervention, I believe it's similar. So the process can take up to 90 days. Now with COVID, things can be taking even longer. So it's not just get in, get out, right? That is the difference then when you go to private practice. If the private practice doesn't have a waiting list, some practices such as clinics, which are affiliated with hospitals and such, are in insurance networks. They tend to have longer waiting lists. Private practices such as mine or other local practices in the area may have a shorter waiting list, may have an opening right away, and you don't need to meet specific criteria in order to be seen by a therapist at that practice. But obviously, the therapist would use their discretion as to whether that child is in need of therapeutic services or not. You can get a formal evaluation done at a private practice. Again, it is not necessary to do that. We can assess as we go, but sometimes you do that for insurance purposes and such. So it really depends on your situation. So that is the difference between private practice and early intervention. And if you do get early intervention services for your child, usually when your child is going to be turning 3, so within 3 to 6 months of them turning 3, the 3rd birthday, your early intervention team will help facilitate the transition to your preschool. So every town in New Jersey has a special education program for preschoolers that is public. It is provided by the state. That's every town. So when you're in that transition from early intervention to preschool, you do need to do the whole intake process, and your child needs to be reevaluated again to see if they qualify for preschool services. And in every town, it's different in terms of what they provide. Some towns offer half-day programs that are 2 or 3 hours or 4 hours long. Some towns offer whole-day programs, especially for children that are significantly more affected. And then sometimes if you have a child with a more severe disability, your town will provide you with an out-of-district school that's specialized for children with disabilities. So that is all of the information that I hope you can use to understand your options when you have a child that you're seeking services for that's between the ages of 0 and 3. So stay tuned for our next episode where we'll tackle a different question on a different topic. Thanks so much. Bye.